Good afternoon. Welcome to today's workshop. I am going to just pass the mic right on to our guest speaker for today from the Chicago Department of Public Health, John Pfeiffer.
Good
John,
afternoon.
take it
Oh,
away.
thank you. Good afternoon. Thank you. I'm John Pfeiffer. I'm the Assistant Commissioner of Contracts and Finance for the Chicago Department of Public Health, CDPH. CDPH's mission is to work with communities and partners to create equitable, safe, and resilient and a healthy Chicago. Our our vision is everyone in Chicago thrives and achieves their optimal health and wellness. That's our mission. We're looking for um, every Chicagoan to thrive and achieve their optimal health and wellness. All our and we so our RFPs, our procurements are always geared towards this. We really especially um, put these values, um, parts of these values, especially when I talk about our delegate agencies, RFPs, but these values are embedded within our our many of our RFPs. So we have four pillars of values at the department: um, anti-racism, informed decision making, teamwork, and excellence. Again, these values are embedded, especially in our delegate agency. We'll have we'll have we'll have guiding. We have a section for guiding principles, um, CDPH guiding principles. It's usually scored. It's usually scored. I think upwards up to 10 points. Again, um, our mission, a lot of our mission and our work is is also reflected into our procurements. So um, I kind of want to discuss the type of procurements we're considered a delegate agency department. We have a lot of federal grants, and we have what we call delegate agencies, which also is known as subrecipients. Um, but we have like four big buckets of contract types of contracts. We have professional service. We're a user of professional services at DPS. These contracts are processed at our partners at DPS. Um, they're generally our larger procurement type contracts. These are for services for the department itself. And then we have IT services and software. We use sometimes we independently use a contractor, but we also use some of the CDPH CDPH, the City of Chicago contracts for those. They're usually housed in the procurement, or they're housed in other departments' MCAs, or sometimes we have to use other mechanisms to procure these contracts. And then we have delegate agency contracts. Delegate agency contracts are what I define as contracts for the community. Um, the the grant language is referred to as subrecipients. They are providing programmatic services for the community, for the department. I this is different. This is a different concept versus professional services. Professional services provide services for the department itself. Department itself. These delegate agencies, we're contracting them to provide programmatic services for the community. And then we have contracts that generally fits in the professional and IT categories, um, and they're called commissioner authority contracts instead of the commission. This commissioner, the commissioner Ige, um, and it has the ability to contract has authority to contract for certain contracts, and it's usually we have a variety of authority. She has a variety of authorities, but one of the bigger ones is she has the ability to execute contracts um, if it's regarding a public health threat. And generally those contracts will fit into they generally would fit into the professional services bucket. But since the commissioner has authority, we at CDPH manage those contracts. Instead of partnering with our partners at DPS, Department of Procurement Services. So those are our four kind of big big buckets of of contracts that we're dealing with. Especially, I have examples of RFPs and solicitations that we are doing this year. So under professional service, upcoming professional service contracts, we have quite a few coming up. Um, our very big This is a very big RFP, and the first one, the temporary professionals personnel contract it's going to be a very large RFP, close to 200. I think the value on this is close to $250 million. This this RFP is we're probably going to see this in mid mid to late third quarter. This is replacing a current contract that we have for temporary professional service personnel. Is with Sunbelt. So the Sunbelt contract is expiring, and we're replacing it with this. Another contract that we use a lot um, is a bundle is our planning and evaluation (MCA). Um, those contracts end at the end of the year. We're looking to continue with a new MCA with new providers for planning and evaluation. We should that probably hit the street. I hope to have that hit the street in for the fourth quarter. Um, Mosquito abatement services. The current contract ends. The current contract ends in mid 25, and this is providing abatement services for our environmental service core, but also the airports use this contract as well. And I expect that to be published sometime next year. And then the last one I have here is the medical and hazardous waste disposal RFP, and we're working on that right now. Um, we, we're still negotiating. It's unclear exactly when this contract when this contract will hit the street, but I anticipate somewhere fourth quarter, first quarter of 25. So our IT software bundle, where we have a food inspection software that we're looking at right now, and we have the Department of Public Health has a wonderful tool. It's our Healthy Chicago Atlas, and this is a wonderful tool. It provides a lot of health data. It's health data to the public. Um, and we're looking for a maintenance on that website with that data. It's very data heavy. So it's just not your standard um, it's just not your standard plug and play on the website. So we're looking for maintenance on for the Healthy Chicago Atlas. So the biggest bundle we manage is our delegate agencies, and we have quite a few delegate agency or delegate agent RFPs that for this year. We have somewhere up to 40. Some have already hit the street, and these are the highlights of the ones that we're planning for. Most of them are going to be hitting fourth quarter, late third quarter, early fourth quarter of this year. So we have the community breast health services RFP, and this is actually a rebid from last year. We didn't get any respondents, and we're gonna rebid this RFP very soon here. We have two immunization RFPs. One's for healthcare providers, and the other one's just providing education to the community. Um, we have a treatment, not trauma, RFP coming out. We have hospital-based violence prevention RFP. This RFP is actually on the street right now. We're planning to do a people's plan for community safety. Again, some of these last three are in our violence prevention bundle. We have quite a few contracts in violence prevention this year. Um, so the next, so this whole slide is the other violence prevention RFPs we have. We have quite a few. We're doing violence prevention, street outreach, a lead, and then we're going to do, so there's a lead that's a citywide vendor, and then we're going to have street outreach for community based. And so this is going to be um, broken up within the city. So we're going to have a city lead, and then we're going to have separate agencies, um, separate regions working on these or providing these services. And the same model is in our victim services programs as well. We're going to have a citywide lead, citywide homicide, and then we're going to have victim services on a community-based level. So there's going to be we're going to award one vendor on the citywide, and then we're going to have multiple vendors, multiple agencies on the community-based services. And then we have the last bundle for our violence prevention group is trauma informed learning cohorts and trauma informed citywide collaboratives. So we have another contract another RFPs they're going to have is the CDBG funded contracts. Those contracts have not been we don't know exactly when those RFPs are going to be exactly. The Department of OBM is working on the consolidated plan, and once the consolidated plan with HUD is finalized, we'll be moving forward with RFPs somewhere in late August. But we first have to develop the plan, and the plan will include like all the RFPs, so we'll have a better sense of the RFPs coming out of this group. In our substance abuse program, we're going to have an RFP for recovery residencies. In our childhood lead prevention program, we're going to have a lead community education RFP out. In our behavioral health program, we're going to have a homeless RFP for clinical services going out later, probably fourth quarter. And so the next bundle of contracts are for our HIV services contracts. We're planning to do a RFP for food bank and home delivery meals. We're also doing professional services, other professional services. This is usually legal services. And again, we're looking for this probably, again, these are probably going to hit late third, early fourth. And so these HIV programs right here, I apologize. I missed our housing for people living with HIV, which we refer as HOPWA. All these last four RFPs are long-standing RFPs for services. But here at Cdph, in the last few years, we have been really working on outreach. And I'll get to that near the end of my presentation. But I'm very thankful for conversations like this because we're really trying to increase our pool of vendors, increase our the number of proposals. Even though these are long-standing programs, we are eager to have new proposals, fresh blood into these, and we've done a couple of things to make this a little easier. And tools like this, where allowing access or allowing people more eyes on this and making aware of some of these programs um, is very helpful. So the last one on this slide is the HIV services for emergency assistance. So the last slide of RFPs for delegate agencies. Again, the first one is an existing program that we have is HIV services for people who use drugs. And then we have this next one is a new program here at CDPH. It's a new RFP for us. It's the Chicago Center for Advanced Public Health Practice. And then we have our Justice for All initiative we're going to do for uh, this is the second time we're doing this. This provides access to abortion services. The next one is is for coming out of a behavioral health program, and this is providing services, providing mental health services on the CTA. And the last one is we have a shelter-based services teams that provide services. We partner with our colleagues at DFSS, and we provide services within the city-run shelters. Contracts under commissioner authority. We're working on one. So this is a ProServe contract. This will be providing mobile immunization programming throughout Chicago. This was especially used during the pandemic. We're still using these type of services for the booster, and this is a continuation of our work in the pandemic. So in regards to outreach, we've done a couple of things. We're doing a lot of things, but these are kind of the highlights that we're doing. Especially, DPS does a good job of pushing out the RFPs and putting them on the website. But for delegate agencies, it's a little bit tougher just because there wasn't like a website. You'd have to be. Our concern was you had to be looking almost every day, and you've just seen kind of the rundown of the programs. If you're doing substance use work, prevention work, and that's all your focus is, you're probably not checking these lists for RFP opportunities every day, and and some of these services come far and few between. So we've done a couple things here. One, we also have our own website here at CDPH for RFP opportunities, and then we also developed a listserv so you could sign up. It's also the sign up trigger is also on, or sign up button is on the RFP page. So these are a couple things that we're doing. We're trying. So if you're interested in in these RFPs, please sign up on the listserv. I'm gonna. So this is our RFP page, and it's like I said, the hospital prevention, the hospital-based violence prevention plan that's on here. We have like we have the 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 bidders conference on here. We have the RFP on here. So this is a very useful tool. And here's what I say. Like if you come here, you can also hit the sign up the sign up button for the listserv. So I'm John Pfeiffer. This is my contact information. If you have any questions or concerns, you can call me, you can email me. Um, and yeah, sign up for the listserv. Thank you.
Thank you so much, John, for imparting that great information to our listeners. And we really do encourage you to contact John if you have questions or you want to find out more information. The website is a valuable resource for that. Our DPS website is chicago.gov/DPS. And there's all kinds of icons that you can find the buying plan. You can find how to sign up for our e alerts. And quite often, different departments reaches out to the Department of Procurement Services for us to put information in the DPS alert. If you are not familiar, that's our e-newsletter and has information that you can use. And so when they're looking for you to bid on certain things, they will all often reach out to us and ask us to post it, whether it is on Facebook, Twitter, which is X now, and LinkedIn. So feel free to look out for those things. And let me last say for this session, John and his team from the Chicago Department of Public Health will be joining the Department of Procurement Services and 79 other exhibitors at our City of Chicago Procurement Symposium, September 5th. So if you are interested in coming to that event and learning more and talking with John in person or some of the representatives from the Department of Public Health in person, in case John is not there, you can always go and sign up at chicago.gov/2024 symposium, all one word, 2024 symposium, symposium. And we will see you there September 5th. Don't meet us there, beat us there, right, John?
Absolutely. I'm looking forward to it.
All right, wonderful. Well, thank you, John, and thank you for those of you that are listening to us. And we will see you soon. Have a wonderful rest of your day.
And thank you. Bye.